When I first got back from the hospital, they wanted me to protect the skin graft. So the doctor told me to, be careful with it. Hello, 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 and welcome back to my channel, Urban Seth Fellas Talking Diabetes. Fellas, I want to thank everybody for coming back to the channel, dedicating some time to listening to some very important information that I have for you today. Today we're going to be talking about a little bit of the experience that I've been through with the diabetes. Unfortunately, I was in the hospital getting a skin graft, which is part of the final process, for me to heal. As you know, I've had my toes amputated on my foot, and I'm just going through the, motion. Well, it's been already 2.5, maybe 3 weeks that I got back from the hospital. I had staples, so I could hold the skin graft while the skin graft holds on. For those that don't know what a skin graft is, that's when they take a thin layer of skin from any part of your body and they put it to where the wound, and they put it around the wounded area. So like that, the skin could close quicker. All right. Now, I'm going to show you something that the doctor had explained to me. When I first got back from the hospital, they wanted me to protect the skin graft. So the doctor told me to, be careful with it. So as soon as I got here, the first thing I said was to put a piece of gauze and wrap the foot. Now, over here, they told me, no, gauze is not the way to go, for the simple fact that since it's a fresh, open wound, and it's true, when the drainage, because my foot was draining, when all that drainage dries up, the gauze is going to stick to the foot, and when they go to take it off, it's going to pull the skin graft out. So this was a no. What they did was they gave me the ABD pad, or better yet, so you can see better in the screen, is the non-adherent pad. Now, the difference between both of them, I'm going to show you right now. The gauze, if you look at the material, it sticks easy. When you apply it anywhere that it's moist and it dries up, it's going to stick because it's like gauze. Let me see if I can open it up real quick for you. But you see, like the threads, how they come off, it sticks very easily. So yeah, the piece of skin that I had would have came off easily. Now, here we have the non-adherent pad. It's a pad. So it would never stuck to the skin. It would protect the skin. So that's why this was a no immediately, and this was a yes. But now that the skin has grabbed on to the wound very well, now this is a no. This is what I need, because since I gotta constantly, keep cleaning my foot, this when it sticks, it don't matter now if it sticks because the skin is stuck to the wound very good. Now when this sticks to the wound and you go to take it off, this pulls out any possible bacteria that could grab on to your wound. So after the skin graft is stuck to, because they put the skin graft goes all around the edges and it starts closing in towards the center. So now this is what I'm using. My doctor told me you need to put a gauze on it, no pad, a gauze. So like that, when you take it off to clean your foot, any possible bacteria is going to come off on the gauze. Now I'm going to show you real quickly what are the things that you need in order to do a wound care. This is for you who are non-diabetics and have a person that's diabetic. You always want to make sure that they check their feet, that they have no wound. In my case, since I already have the wound and I'm taking care of it every day on my own, I have a bucket with water. In this tray, which is the first tray that I'm gonna use, I have a garbage bag, I have soap, I have a chuck, which is for me to lay on the floor in order to put my foot on top of it and clean the foot. And I got washcloths. Last but not least, once I've used this bucket to wash my foot with everything that I have on this tray, then I go to my final tray where I got the gauze, I have the Curlex, I got some A&D ointment, the tape, and my gloves. My gloves, I'm going to use it from the very beginning, from that tray. Because you always must protect the wound. Make sure it doesn't catch any type of bacteria of any sort. As you're going to see in the video, the wound care is very simple. The only thing you really got to do is make sure you got your gloves on. You know, you want to be very hygienic when it comes to doing the wound care. You want to take off the old dressing, have some water, like you already seen. I showed you all the materials that we're going to be using. But, you know, have some clean water, have some washcloths. You want to wet the foot very well. As soon as you wash the foot, wet the foot, you're going to grab some soap with a different clean cloth, and you're going to rub the soap on the cloth so you can, soap up your foot. Make sure that you soap up your foot very well. You soap it up very thoroughly. And once it's soaked up, just rinse out the water, the soap of your foot with another clean cloth, another washcloth. Once you have done all of that, then grab another cloth. Make sure that it's dry. Dry your foot very well, very thoroughly. Dry it, to you feel that it's dry. Once you completed all of that, then you're gonna grab the A&D ointment and you're gonna moisturize your foot. Because remember, we struggle with having dry skin, and that's not good for a diabetic. So you wanna, moisturize the foot, keep it moisturized at all times. As soon as you finish moisturizing your foot, then you're gonna take the gauze and you're gonna put it on the wound. Once you place the pad, the gauze on the foot, then you're gonna grab the Curlex and wrap your foot up. As soon as you're done wrapping the foot up, grab a piece of tape or two pieces of tape, tape it up, put your sock on, and guess what, fellas? You're already done with the mission.